Welcome to the Movement Minutes with your host, Reed Nellis. Here, we pursue the human connection. We learn how to empower one another. We discuss clinical pearls. We discover our passions. We reflect on our capacity to achieve. We remain open to novel trends and concepts, because regardless of our backgrounds or experiences, our successes or failures, we all speak the same language, human movement. We're back. Sorry for the week delay here, everybody. I try to do these every 2 weeks. Last Monday, I was still in Mexico with my family. First vacation that I've taken in like 7 or 8 years, so it was good to get away, but I apologize. Today's guest is Dr. Aaron Kubal. If you haven't heard of Dr. Aaron, I don't know how. He's all over TikTok, all over Instagram, all over a bunch of podcasts and everything else, being a very outspoken individual, which is what I love about Aaron. It's easy, and I totally understand, and Aaron totally understands how a lot of people hate him, or at least hate his stance on things, especially before he even graduated. He's a recent grad of chiropractic who has been known to bash chiropractic, but more so bash manual therapies, cupping, foam rolling, the traditional way of doing things in general, based off of research. He's a huge nerd, which I love, and follows the research to glean his stance from, right? I think more of us should be doing that better, okay? And what I'm pleasantly surprised by in today's conversation is how Aaron openly admits that he's been wrong before. A lot of people who have been following Aaron might know that he has a strong opinion on things, but he's okay to say, electrical magnetic frequency, blah, blah, blah. Maybe research in 5 years might come out and say that that's doing this, and I'll lean into that. He's just presenting what is currently understood based off of the research, or based off what we call evidence-based care, which is what more of us should be doing again, okay? So again, before I get too far into today's conversation, Aaron practices telemedicine. He's a local Minnesotan guy, so of course I've got a soft spot for him, but I'm super excited to show this podcast to you, whether you're viewing it, listening to it. Awesome conversation. So without further ado, here's Dr. Aaron Kubal. All right, everybody. So we just heard the formal intro for Aaron, but Aaron's a man of many mysteries and many things, and a very vocal individual, as we just heard in the intro. But we'll give Aaron a chance to talk about himself. Aaron, tell us about you. What's your background? What do you do? What are you interested in? Tell us about Aaron.
Sure. Yeah. Background, what I do, what I'm interested in. My name's Aaron. I'm a chiropractor. I do virtual care for pain. Typically chronic pain is usually my, like 99% of the patients I see. And that's pretty much it for clinical practice. It's just telehealth all day, every day, and self-management programming. And then outside of that, I'm pretty active on social media. And yeah, that's really kind of it. There's not a whole lot to it.
It's pretty simple, right? Simple. If you guys have been living in a hole and haven't heard of Aaron, I doubt it. Things that he puts on social media, whether it's TikTok or Instagram, have their ways of blowing up and getting some kickback. So I want to start talking about that. First and foremost, you say sure. Chronic pain and dealing with what I call unexplained medical symptoms, or unexplained medical diagnoses, where we have varying research on this, but anywhere from 30 to 85% of what people feel, a ailment, a injury, a pain, a discomfort, a tightness, a tautness, a zing, a twinge, or whatever the fuck you want to call it, those things, 35 to 85% of them don't have a diagnosis, right? And so when we're dealing with chronic pain, we have to lean into the research and figure what that's about. You're heavily into the research. How did you get so intrigued by it? Are you really that big of a nerd, or what's the deal with that?
That's actually funny, because if you knew me like in high school or even in undergrad, you would have been very surprised to see me end up like being the guy who's on video camera with research papers flashing behind his head all the time. You would not have expected that from me. I didn't really give a shit about any of that kind of stuff, coming up through high school and undergrad. And I didn't really even care about like being smart, or really like I would apply myself in school because like it would make my parents happy, but like I didn't really care about academic work or anything like that all that much. But what I did always kind of have as a trait that I think has segued into this, heavily handed use of research would be just asking a lot of questions all the time, not like as like a critical thinker per se, but just because like I don't get a lot of stuff, and it takes me a lot of repetitions to try and understand anything somebody's trying to teach me. So I would just always be asking, 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 and that carried into chiropractic school. And the trouble there came with like the more I asked, the more
Yeah.
mixed answers I would get, and the more answers I would get that were either conflicting or didn't make sense. And like I had to defer to something, and that was when I started first learning how to like actually critically appraise published studies, and then how to kind of weigh them against each other and start using them. So like I needed that to get answers to the questions that like I couldn't help asking. And I don't know if answers is the right way to say it, but you know what I mean. Like I
Guidance.
I
Yeah, for
couldn't
sure.
just
It's
rely
a
on. Yeah, exactly.
exactly. And trying to navigate the bias with that, like you, what I think I like most about what you explain with the research, what you present is just the research. You don't give a bias. You say this is what the research says, but also this research article completely conflicts that, and you don't navigate, or you navigate the bias really well, whether that's pro or con to the study or topic that you're discussing. Something you said is really interesting to me, and being inquisitive and always being a learner led you into this. And I think Simon Sinek's like idea of be the dumbest person in the room is huge. Like the dumbest person in the room learns the most because they ask questions. Like every single one of us clinicians are idiots. And anybody who tells you otherwise as a provider, clinician, or coach, or therapist, whatever the hell they are, is lying. Like not a single one of us has all the answers. Not a single piece of published research has the answer. Well, I guess I could argue with that, but they lead us to, and like you said, it's not the answer. It's a guide. It's a direction to get more. It's a direction to ask more questions. The question is the
Sure.
answer, kind of thing,
Yeah.
right? For
Uh,
sure.
yeah.
So
Absolutely.
specifically talking about research as it relates to clinical practice, I want to pick your brain on this. The difference, because every clinician, whether you're PT, ATC, chiropractor, massage therapist to some degree, medical doctor, orthopedist, all of them want to be evidence based. And I personally have a trouble with the term evidence based versus the idea more so of being evidence informed. I personally, and this is, I want to kind of push your buttons here a little bit and see what you have to say. And if you agree with me, great. Um, but I prefer to be evidence informed, and we call this like guided but not shackled by the research. Because if we only do what's evidence based, let's take foam rolling. I think you have a good stance on foam rolling. If we look at what foam rolling does, research says like you might as well just like rub your back up against a wall, or just like poke yourself in the head, or like touch is touch at that rate, right? But if we look in case studies, there's definitely people who scream from the mountaintops that foam rolling saved my life, right? So being
Yep.
guided by that on an individual basis, but not shackled by like, hey, there's this person with an ankle pathology, like research says foam rolling isn't going to work for them. Well, and like heavily backed up. But clinically and case
Yeah. Well,
studies
that
wise,
I
there's a
think
bunch of
that's
people
a
that do.
really Yeah, I think that's a really good way of setting up the question and a way of wording that. Because the way I see it, first of all, evidence based is just like I even get tired of hearing it and seeing it. And I have it in
It's a
my freaking
trigger
bio on social media, and like I look at it as like to me, it just comes across now, even in my own usage of it in my bios and stuff. It comes across as just like a marketing kind of slogan.
for sure.
Like
Yeah.
it seems to mean more for like just trying to portray yourself a certain way from a marketing perspective than what it actually means for clinical practice or critical appraisal or anything like that. So I think when it comes to evidence based versus evidence informed, I know you said like the feeling of like being shackled by the evidence. I see it the opposite way in the sense that I think when you look at the totality of the evidence, when we're talking about pain, just with how big of a mess pain research is,
Hmm.
I think it's a lot more freeing than shackling because it shows us that there's so many options and so many ways to have a positive influence on pain that you're not going to be hamstrung to like one way of doing things, and there's a lot of ways to go about it. I think the only place where I let the research steer me a little bit more heavily handed would be when it comes down to narrative and how we explain. all
Yeah,
these
for
different
sure.
interventions. So like if we were to talk about foam rolling, I have no issue with people foam rolling if they want to use a foam roller. Or I even saw a viral video going around the other day of somebody using a giant like lead foam roller that weighs like 150 pounds on their
Mashing,
freaking
yeah.
quads or something
Yep.
crazy like that. Yeah, like an iron roller. And
Yep.
I don't have any issue with people doing those things if something they perceive as helpful. But I think it's also always worth, again, asking more questions, saying like, why do they think they need that? And why are they using it? Are they just using it because it feels good and it's part of their routine? Like, cool. I just get concerned when people are using it of because they think it's supposed to have this certain effect, and the only reason they're
Right.
doing it is because they're pursuing that, and that might not be in actuality. And like if they knew that that's not what it did, then they probably wouldn't be doing it. That's where
Right.
I kind
It's
of get um, a crossroads
conflicted.
there.
Yeah. And I think the
Yeah.
the statement that I use there is, or question rather, is what we're doing actually doing what we think it's doing? Is foam rolling actually doing what we
Right.
think it's doing, or can we get the same or more beneficial results from doing something completely different, but that's actually doing what we think
Right.
it's doing, right? Something you said there, and I just want to clarify my stance on it, is guided but not shackled in a singular tool or tactic, right? Like we mentioned specifically foam rolling. Like you said, and I love that you brought this up, there's a plethora of ways to mitigate, manage, address pain, and especially as it relates to these unexplained medical symptoms, chronic pain, we could call that. Not one singular tool is the answer for anything, just like not one singular clinician is the answer for everybody that walks through the door. I'm sure you have had this already in your career. And I tell people this all the time, like, hey, if you're a first patient or a new patient, this is a first date. Like, I have no fucking clue if I'm going to be even a portion of the answers you're seeking, but somebody else might be, somebody else who thinks differently than me, somebody else who uses different tools, different
Yeah.
tactics, etc., right? So that's what I meant by that. The other thing that you brought up that I love
Yeah,
is
absolutely.
you said perception. um, what's your stance on placebo versus perception as it relates to research? Because me personally, I think, if we can get an individual in a study, randomized controlled trial, case study, SR, whatever it is, to gain, and I think we should measure this more, perception of benefit, we could look into that as perception can become reality with these specific chronic pain cases that we're talking about. If I feel better, I feel um, a potential benefit, I'm going to personality wise, mentally change and start leaning into that idea and move more and more and feel better and better and kind of get this good vicious cycle.
Sure. Yeah, I think the first problem is when we talk about placebo. I think clinicians, students, people in like our field have kind of a mixed definition of what we're even talking about when we say placebo. Because I think a lot of people hear the word placebo and they assume that we're implying that whatever we're talking about is useless, right?
Right.
And all that really means when we say that it doesn't outperform placebo, or that it seems to be an intervention that's largely driven by placebo effects, that usually implies that it's contextual effects that typically mediate the outcomes, and the outcomes that we see with certain interventions that kind of get chalked into this category. They're not unique to the intervention, rather they're more of a result of the context and some of the things that we can't really control for in that situation. So I just think when we're looking at it that way, um, you can kind of have an appreciation for, like you mentioned, those case studies where people feel like foam rolling is like life changing for them, right?
Hmm.
I think it's worth acknowledging that a lot of that probably is contextually driven. So we should just look at that and say, okay, for them, why was that such a useful intervention when there's so many other people who don't find it useful? And when we know that, a lot of the clinical outcomes aren't structurally mediated. Is it because they have a lot of friends and family members who use foam rollers? Did they get a really good pitch when somebody was saying how useful it could be? Does it just feel good to them and that's all there is to it? Do they see professional athletes using it and think, oh, like if they do it, then
Right.
I should definitely do it too? Like there's so many different factors that can have a positive influence on those outcomes,
Right.
that I
It's
think,
the biopsychosocial
it doesn't
model of,
necessarily. Right.
yeah. Sorry, we got a lag for you listeners. So like anytime I inject or Aaron talks after me, like it's a and I'm a very good interrupter of people speaking. I'm horrible at that. So I'm gonna be talking over Aaron here a little bit.
You
Sorry.
know what? You know what, Reed? That is actually a pretty sweet lag. I think I can probably, so I paused that upload, but um, it's still like on there. If I X out of that, that might actually help because that's a pretty nasty lag. Should I just try to X out of that and see if that helps?
Yeah, worth a shot.
Because I don't want the recording to be like ruined for you or anything.
No, it's all
Let
good.
me try and do that.
It's not terrible. I can always cut up your audio versus my audio and just backlog them a little bit, half a second.
Gotcha. Okay. Uh,
I'm just gonna dance here while you're doing this so that when I'm editing this, I know to take this out because then I'll see myself dancing.
all right. Hopefully that makes it a little bit better, but that should be X'd out now.
Perfect.
Am I coming through okay?
Yeah, you're good. You've always been good. I
Okay,
just feel like
sweet. Sorry.
my audio to you is lagging a little bit. So
Gotcha. I think we're all right.
perfect. So switching gears here a little bit, and I mean, I could talk about research with you all day long. And I think what I take away, like I've chatted with you in the past a lot about this and other topics, but I think what a lot of the public perception of Aaron Kubal is like, oh, he's just an asshole and blah blah blah. He bashes everything. Like you're a human first, right? And like you're just a critical thinker, an inquisitive person who puts this stuff online because nobody else is doing it. So with that being said, like a lot of people think you're an outsider, which I think is dope, right? How do you feel like you fit in as this outsider, this inquisitive questioning? Some people say bashing chiropractic, which not to make this a longer question than it is, but
Yeah.
chiropractors, especially me being one, think that all you do is bash chiropractic. You don't hold anything against all the other professions either. So you're not saying that chiropractic sucks. You're saying that this model or this idea or this research or like you bash everything equally. You don't nitpick just chiropractors. I think that's something that chiropractors forget. But how do you feel like you fit in being this outsider as the public persona images you?
I think we benefit much more from discourse than anything else, and if everybody was in agreement all the time, I don't think that people would continue learning and continue, pursuing trying to be a bit less wrong day in and day out. I think it's normal and it's healthy to argue and disagree. And I think it's fair for people to look at it like I'm bashing because there are certain talking points I have that you could definitely say sound negative. I have not seen it that way in the sense that I do feel like I'm just trying to remain objective and just say what these different studies and different clinical practice guidelines are saying and just communicate that as best I can. And I do try to make disclaimers that it's not to be taken as like this is bad or no one should ever do XYZ thing. It's just this is not what it seems to do. This is what it seems to do. Whatever. So I think I just that's one perspective and that's one thing that I can try and offer to just to create that discourse because that is what leads to more productive conversations. Like I always like pointing out, we always acknowledge how complicated pain is, right?
For
So if
sure.
pain is really this complicated and there's a lot we don't know and don't understand about it, then the opinions should be really vast and there should be a lot of disagreement. Like there'd be clearly something wrong if like we say pain is very, very complex, but then we're all in agreement about everything about pain. So I think I'm just another voice offering, opportunity for conversations, whether they're hostile, whether they're professional, whether they're whatever, as long as it's creating some type of discourse that continues to push people to keep looking into things. I think I'm just another one of those people doing that. There's a lot of people that do it.
Absolutely. And I think this was said to me a while ago, but like if you took a Vladimir John, Dan Johns, the fascial construct people, I mean, you take a bunch of big heads, let's say 20 big heads in the strength and conditioning, body work, chiropractic, PT world, and you threw them all into a room with a couple beers. They would bitch and moan for about an hour, maybe 2 hours about who's right and who's wrong. But if you were to like, be a fly on the wall there, everybody mostly in agreement with like 90% of what everybody's agreeing. It's the 10% outlier that separates us. And I think that's what makes providers, clinicians, thoughts, philosophies genuine is we get to pursue that 10% difference as a passion and help that 10% different of clientele get better because they wouldn't have gotten better underneath a different model or a perceived benefit or however we want to measure that in research, right? So
Yeah,
I
well,
think
that's the thing too, is like because when you really boil it down and strip away different verbiage and things like that, like we really all are for the most part kind of just doing the same thing, but just putting different spins on it. So yeah, like it should end in majority agreement. I think a lot of the times where we bicker and disagree usually has to do with things like narrative and stuff that probably doesn't even really influence outcomes that much or really carry that much weight anyway. But
right.
yeah, I think there's still people. If you take a step back and look objectively, we are still all kind of doing the same job and doing a lot of the same stuff, no matter
I
how
mean,
we
yeah,
look at it.
at the end of the day, all of our goals are to get people better, right? Like
Right.
whether it's mentally, spiritually, physically, emotionally, cognitively, it's all just getting people better, right? So
Sure.
you kind of mentioned this a little bit ago about negative versus positive feedback per se of what you're putting out there on social media. And again, if you guys haven't heard of, seen, follow Aaron on social media, do so because there's a lot of great content and a lot of great comments. I always thought that you must be blocking, deleting negative comments, but I don't think that's the case. And you don't need to show your hand here if that's the case. But like if you look at the comments, and I'm not on TikTok because I'm old as shit, but Aaron is. Um, if you look at the comments on Instagram, like there's an overwhelming majority of positive, like this is awesome, keep it up, bro. Like this is hilarious. I'm gonna share this with my friends. You know, there's a lot of positive comments, and I think that comes from pushing that boundaries and being an outsider or an outlier per se and challenging the current understanding, right? Do you actually block comments and content, or and B, how do you deal with when there are negative stuff? Because there's some legit people in groups, and I'm not going to name names, and I don't expect
Oh
you to,
God.
that absolutely hate everything Aaron Kubal stands for.
Yeah.
Not even like they can appreciate it, but they don't agree with it. Like they straight up hate you. How do you deal with that?
Yeah. I definitely don't delete comments. You know, if you do go on TikTok ever and venture over to the absolute hell that is TikTok,
Pass.
those a
Heavy
lot of
pass.
those posts on there, they have like hundreds to thousands of comments on them. So for me to like go through and scrub it and like delete ones that I don't like, that would be insane. Plus, I love the negative comments, and I if you look in my you know, there's a lot more of them on TikTok because you get exposed to a lot more people. But if you and a lot more of a diverse crowd. But if you look on Instagram, like when you see negative comments on there, you'll see me like jumping in and like, and it really honestly just depends on a variety of things. Just the day you caught me on, how the
Right.
first comment was laid out, whatever. Like sometimes I'll be, professional and like constructive and ask guiding questions and like try to come to agreement. And sometimes I'll just fucking go at it with the person and argue and be unprofessional. I think like I don't like the idea that we need to carry ourselves so professionally all the time. And I think you would agree with this too. Like you should just be who you
Absolutely.
are because when you're working with patients, they want to trust you and they want to feel like they know you. It's hard to do that if you're putting on an act all the time, like you're this like academic, well-spoken, perfect, whatever. So I don't try to pretend to be that. And if sometimes in the comment sections, I'll throw down with people and usually my DMs, if you want to see the real bloodshed, DMs is where the nasty stuff is. But no, I,
Just
I like I
blood and
said, I
gore.
love it's brutal, but like I said, I love discourse and I love arguing. I think I always look at that as an opportunity to one get better myself if I am actually wrong. Like I'll look into that and update and it's also an opportunity for me to strengthen my own my own communication skills, like learning to debate, learning to
For
argue back
sure.
and forth with people. That's a really good way to floss out how effectively you communicate a topic to somebody. So I always just look at it as it's more and more opportunities to sharpen up and get better at different things. And when you put yourself out there, sure you attract a lot of negativity sometimes if it's controversial, but you'll also attract a lot of people that agree with you. So that's also been kind of a nice benefit is um, building out kind of a support group. But I think the benefits definitely outweigh the cons when it comes to like actually engaging with negativity and not just ignoring it or deleting it or sliding under the rug. Like I think you should, unless it like if it's an ad hominem where somebody's just like you're ugly or like like just fuck you for no reason. Like yeah,
Like,
I
thanks, I
don't need
didn't
to
shower
respond.
today.
Right.
Yeah.
Like I don't need to respond to that. But if they're saying something real, even if it is negative, if it's a real thing, I'll definitely engage with that. I think that's a good thing to do.
Yeah, I mean, like, I remember it was probably, I don't know, 7, 8 months ago. I can't even remember what the post was or what it was about. It was like in your, now looking back at it, like infancy of having this role on social media that you have now. But I said something to one thing, and like the number of people that like immediately attacked me, and then like bro, like you had like a very, I must have caught you on a spicy day because like you shot back like full spitfire coming at my throat, and I'm like, fuck yeah, I love this, let's go. Like, and then I don't think we shot much back, but like I shot you a text, I'm like, dude, let's go, like let's talk about this. And I think that's awesome. Like, I call this
Man, I wonder
for,
what it was.
I wish I would have done my homework and thought of that before having this conversation with you. But
Yeah.
I see that as like two dudes just picking on each other, right? Like if I'm hanging out in the locker room and I start ribbing one of my buddies and chirping at him, like I expect them to rib back, right? Like the number of people that saw that comment and shot me a text individually, and they're like, "Dude, Aaron Kubal's roasting you right now. Like, you got to come back." And I'm like, "Yeah, he's right. I'm just picking his brain on like what he thinks." So like, God, I wish I would have remembered what the post was or what we both said. But moral of the story is, I did not lose any sleep over it that night, no matter how much people were worried about my well being. But and I think that's crucial. Like what we keep coming back to is you're just an inquisitive person, and I think a lot of us are. You just put yourself out there a little bit better and a little bit more than everybody else, right?
Yeah, well, I mean, like, it's more fun too to
Yeah,
like get into the weeds with people and like have disagreements and talk through things and like really force yourself to think about it. Like I always think it's a good litmus test for me too. If somebody criticizes something that I've said or something that I'm a fan of, and I catch myself like feeling really defensive or like offended by what they're saying, like that's a good indication for me that I should probably look into that a little bit more. Cause like I didn't invent any of these treatments. None of us
right.
did. I didn't invent chiropractic. I didn't invent, self-management. I didn't invent any of this stuff. So none of us should really have like such a strong personal
A-
investment in it.
Adherence, yeah,
Yeah. And like if you feel attacked or defensive by something, it's a good sign that maybe you're hanging on to it a little too tight and you should take their criticism seriously, and
absolutely.
look closely at it. So again, it's like it always just ends up being different opportunities to kind of check yourself and try and improve. Like I'm excited for the next, and I've already done it a few times actually, but I'm excited for the next 5, even 10 years, um, to be able to like look back at things that I used to really like, and be able to then call myself out like the way I call other people out currently and be like, yep, got that one wrong. I don't do that anymore. That I've
Yeah,
chucked to the wayside. This I didn't used to do, but now I do that.
absolutely.
One of my perfect example of this, right? Like one of the things that I've changed my stance on, like I used to rip like tens units and like hot packs and shit like that,
Yep.
and say that that was all garbage. And I've completely changed my tune on a lot of passive modalities actually, because and that's part of what's just come with a year of experience and practice is you take a closer look at some of these things and like a tens unit, okay, like I don't want to see, a chiropractic office that's clearly just using the tens unit as a placeholder and turning it
Right.
into a factory. And it's like you got one on the tens unit, you got one on the table, you got one in the gym, and
And
then you just cycle them and
billing the
triple
shit
book.
out of insurance.
Yeah,
Yeah,
like
yeah.
that's obviously trash. But also tens units can be like if you're talking about somebody dealing with persistent pain, for some people like that can be their lifeline. And that can be the
Right.
only thing that just blurs the noise for a little bit. Is it actually doing anything like changing their body in any meaningful way? No, but it can still, modify symptoms in a temporary way, which is still very, very meaningful to somebody who has unrelenting everyday pain. And if you can find a tens unit for $30 to $40 and it's portable on Amazon, I don't see how that's not self-management just as much as anything else that we talk about and advocate for with self-management, you know?
Well,
So
and
that's
again,
where
it's
I've
it's
flipped on
it's the
that.
question of, because like I was in the very much same camp, and I'm still not like completely in love or married to the idea of tens units specifically.
Yeah.
Um, but like if we can think of it as, and it's again the question of, is what we're doing actually doing what we think it's doing? If I
Mhm.
put a tens unit on somebody and expect it to do what the manual tells me that it's doing, or what somebody in chiropractic school or at a convention told me that it's going to do,
Yeah.
which is why I bought a $1,500 one. I did not. I did not do that. I would never
Okay.
do that.
Okay. Good
Um,
disclaimer.
I'm saying like if I was that person,
Yeah,
right?
yeah, yeah. I got you.
I don't actually own a tens unit, not even like a portable one. So it's I'm speaking a little out of turn here, but if I can use that more so as a distraction therapy, to open a neurological window so that we can load this area. Let's say it's chronic low back pain. If I throw some tens unit on there, it distracts their brain or raises awareness to that body part and area and tissue, so that they are more attentive as we start to load and progress their self management care, their at home strategies. Like, yeah, that's a huge win. If that's the kicker, if that's the key to enter the stadium, like boom, that's it for that individual. Now that doesn't work for everybody, and that's where things get sticky, right?
Right. Well, and
Um,
that's where I look too. Like it's always that like kind of window of opportunity sort of narrative with a lot of
yep,
things. And like I go back and forth on that a lot. And again, like if the claims aren't like too big and we're not saying anything crazy, like who gives a shit? You can go ahead and do whatever. But I just always, again, I always look at all of those kinds of things, and it's always worth asking, like, okay, if the premise of me putting this thing on this person to do this either painful or feared or both activity, is there a way that we could do it without that? Is there a way that we can like, is this always necessary? Is it not? And like you said, for sometimes it's not. Some people, it feels like it matters more. I never, I, what's so interesting about telehealth only is that, like, for me, um, I think it brings into question a lot of different things that we do in person. Because if somebody doing telehealth is able to replicate something like that in the clinic and get somebody to do some of those things without, you know, cueing them this way or putting XYZ thing on them or whatever. Um, I think it's a good way to like question, like, do we really need to do this? Do we not? And then if the answer is we don't need to, but we can, then again, like as long as the narrative's on point, we're not overselling anything and we're
right,
just pitching
right,
it as an option that could help, then who cares? But it still just kind of boils down to like how much we're hyping certain things.
for sure, for sure. One more thing that you just said before we switch gears here a little bit is be who you are. I think um, us even like we dropped a couple f bombs and s words here, and like no c words thus far, but who knows? There's still a lot of time left. But um, be who you are is a huge thing. I just had an intern in here yesterday, and he's like, "You legitimately just talk like a dude the whole time with patients." I'm like, "Yeah, like if I'm acting like me and wearing joggers and a t-shirt like I do every day and sometimes a backwards hat, like people are going to connect with that. Does that push people the opposite way? Absolutely. But those people would never get better underneath my care if I was wearing scrubs or a white coat anyways, right? Like if I don't get to be me, my patients aren't going to get to be them because I'm not my best me, right?
Mhm.
And so that idea of fill your cup is kind of huge. You know, you got to fill your own cup before you start pouring in others. With that being said, and switching gears here, so maybe not the best segue. How how did you start getting interested, and what was filling your cup to get interested into chiropractic school from the get-go, and what was the timeline into chiropractic school that changed, a year in, 2 years in, a dramatic experience, if you want to share that, where you're like, dude, everything I'm learning, like you
Yeah.
already mentioned the research and how you started to look into that a little bit further, but um so what was the kicking point to get you into chiropractic school? And did you ever think about getting into PT school right off the bat? Because I think that's a lot of what your followers and cohorts think of you as, is like, oh, this is a chiropractor who'd just rather be a PT. And I don't
Yeah.
think that's the case.
Yeah. Well, and I get that question like all the time too. Like, why don't you just become a PT or why didn't you just go to PT in the first place? And I always tell those people, like, why would that change anything? PT suffers from all the same problems we do. And
Yeah. Well, like I
it's
said earlier, like
outpatient.
you bash PTs just as much as you do chiropractors. So it's
Yeah. No, I've cited the papers from Josh Zadrow, both 2019 and 2020, showing how poor physical therapists' adherence to clinical practice guideline is. I think I've done that like 4 times now. So I like, and I think that's only fair. Like if we're in the field of conservative musculoskeletal healthcare and I'm being critical of chiropractic, it would be pretty hypocritical to not also take a critical look at physical therapy, occupational therapy, and anything else. So, with that though, yeah, like I said, PT suffers from all the same problems. That wouldn't really change uh, anything for me. But the way I kind of got into this, I was never exposed to physical therapy growing up, so there was never any interest. But I did go to a chiro, and him, Jason O'Donnell over in
Hmm.
Excelsior, and Jason's a great dude. And growing up, like he took care of me as a multi-sport athlete, and whether it was like a pulled hamstring or my shoulder would be sore from throwing, like the type of support he gave was always usually just good advice and like helping me kind of navigate like in season injuries. And I thought it was really cool how he educated and gave useful information that would help me kind of figure out how to best approach pain in different areas within sport. And I just saw him do that and liked how fun he made it seem and wanted to do that for other people.
I
That
mean,
was my
here's
only.
here's a measure of how, like, just to kind of add on to this idea of your introduction to a chiropractor is
Yeah.
like Jason O'Donnell. So I moved to Excelsior, for those listening. Like, I'm in Excelsior, Minnesota. Same thing as Aaron here. He's just down the street. Actually, probably could have done this thing live in person, but
Oh my God.
hashtag
Yeah, we
COVID.
totally.
Yeah, I didn't even think about that until now. But I reached out to Jason when I moved here, and he's like, "Yeah, man." I'm like, "Yeah, I could stop by the clinic and learn a little bit more about what you do." Like, I didn't want to push too many buttons. He goes,
Yeah.
"Let's go to Excelsior Brewing Company and have a beer." I'm like,
Yeah.
"Down." Like, so
He's
that's
great.
that's the kind of guy we're talking about here. But yeah, sorry,
Yeah.
continue.
He's the best. So, and like he was my only impression of chiropractic.
Yep.
I literally assumed what he did was exactly what all the other chiropractors do, and that's just part of me being like naive and not being responsible and actually investigating. And that was literally all it took for me to say I want to be a chiropractor and commit to going to chiro. Like I knew in high school that I was probably going to go to
Yeah.
chiro school purely based on the care that I got from him. And then, I started chiro school and it was just not that. And there's a ton of stories. Like there's so many different instances that just slowly kept kind of breaking down the walls and making me, rethink what I was doing and making me consider dropping out and switching careers. And like it was like quarter life crisis after quarter life crisis,
Yeah.
over and over again. I think if I had to point out, did you ever do like the applied kinesiology like seminar stuff? You remember them ever coming to your school
Yeah.
or
I mean,
anything
I,
like
I
that?
sat in on them, and like I worked, one of my internships was within a AK clinic. So yeah, I'm very familiar with the
So
idea.
there was a girl in my cohort who I wanted to date, and she was going to that seminar, and I knew
That's your
that.
problem, dude. You never chase the girl. Aaron,
So, and I
you
ended
haven't
up
learned
dating her for
anything?
2 years too. Disclaimer. So that was nice, but I went to the AK seminar because I knew she'd be there, and that AK seminar, swear to God, it broke me. Like I was so blown away. Um, of course, by like the content just being absurd, but beyond that, how like just willing students and practicing clinicians were to just accept it and
Yeah.
like cheer it
Not
on
question. Yeah.
without question. Like they were like, "This is the greatest thing ever." As they're all doing that, I literally had a full notebook where every single thing the main speaker would say that I was like, that sounds weird. I would just write it down and then I would go home. And then the night before the next day, I would literally like try to tear through and debunk every single thing that I had written down that day because it was so insane to me. And then
See,
by the
see,
end of it, yeah, go
let me
ahead.
correct. So let me just confirm what you're saying here is you went home and you tried to look up to confirm that bias. You weren't trying to debunk it right off the bat. You were trying to actually make sure that everything they were saying was correct, and you couldn't find it. Is that what you're saying?
I mean, it was like I was under the impression because I think like bias, you can't escape that.
No.
So I was just when I heard the thing they said, I would be under the impression like that sounds wrong. I'm gonna go see, if that actually is wrong. So like it was leading in the sense that I was looking to see if it was in fact wrong
Yeah.
rather than looking to see if it was right or wrong. But
Right. Right.
still, like I mean, the shit they were saying was just so blatantly absurd. And so by the end of like it was like one weekend every month for 4 months. And it was like full weekend. It was Saturday, Sunday, 8 hours each day. By the fourth time, so after doing 4 weekends of it, I was so like just upset
Yeah.
that this was even like allowed to come onto campus and allowed to even it was insane to me that there was even an applied kinesiology club like in existence. Like it was just so messed up, and that was where I finally was like, no, I'm not doing this anymore. This can't be my career. I can't be associated with this. And I like was fully convinced. I was telling like my closest friends that I was out. I planned to like go to administration and tell them like by the end of the week. I even told some professors on the campus, and they luckily by the end of the week they'd talked me out of it. But
Walked you off the
I was
cliff.
like looking up like MCAT study groups on Facebook, and
Yeah.
like I was googling how hard is it to get into medical school and like bullshit like
How
that. And it
how
was
many of my credits would transfer if I changed right now with
yeah,
$250,000 in student loans already?
yeah. And
Like,
that was truly at like the halfway
yeah,
point too. Like I was a try five, so I that's how bad it was that I was like I don't even care that I'm halfway. This is crazy. And luckily, like I said, I'm still super grateful that I was talked out of it, because now I love my career and I truly enjoy my job and I care just too much about
yeah.
everything that we do. So I'm glad that it worked out the way that it did. But I mean, there were a lot of moments just like that AK seminar that were so shocking to me throughout school that just, oh, that was a rough 4 years for sure.
Well, and I think what like I'm sure you've had a lot of people reach out to you just like I have, like incoming potentially incoming students or students that are in their T1, 2, 3 and starting to get exposed to some of
Hmm.
these elective options and where you can go is like getting back to be yourself. Like if you're not interested in AK, like there's some I mean, the clinic that I was in, they've been in practice for 40 years. Are they getting people better? Yeah. How does it work? I don't know. I didn't resonate with it, right? If that doesn't fit your jive, there's so many different models that you can go down. And I like when I meet somebody who, has conflicting ideas of chiropractic or healthcare in the touch world of healthcare, so PT, massage, chiropractic, right? ATC to some degree as well.
Hmm.
Is I'm like, listen, we're not dentists, right? And like whether that's for good or bad, I can get my root canal here in Excelsior or down in Albuquerque, and it's probably going to be a very similar procedure. I could see a chiropractor here in Excelsior and literally right down the street or go to Aaron, and I'm going to get two completely different ideas, right?
Yeah.
That might be great, that might be bad. It depends on the person that we're dealing with, the client or patient that we're dealing with. But I think it allows us to be genuine and it allows us to do that. And I think a lot of incoming uh, potential providers or students in any portion of the game forget that like you can make that world your oyster and you can do whatever the hell you want to do within your scope of practice, right? So yeah, it's huge.
The only area there though, and like I say this all the time, the only part of that that always give pushback is because I hear it all the time is like as long as they're getting people better, like who cares, right?
Right.
And I always really contest that because there is so much room for misconstruing like what's actually happening clinically and what is outcome wise, like are they getting better, like because I cite papers, and like I think the most frequently shared paper that I cite is God, what's his last name? It's like Martis or something like that. Artis, that's what it was. But yeah, Artis, and it's a 2010 paper, and it looks at like literally every decently popular treatment within like physical therapy and chiropractic, and looks at applying all of them across the spectrum to a whole bunch of cases of acute low back pain. And when they graph out like the trajectory of recovery from that episode, no matter what treatment gets used, including one where there's no treatment,
Yeah.
everybody gets better at the same rate. And then we look at that and say, okay, are we actually getting people better in a lot of these cases? Or do almost all musculoskeletal conditions and complaints have a very positive self limiting natural history? And we just happen to be at the right place in the right time. And now we're getting credited for
Right.
getting them better when really like a few weeks just passed. And even if they didn't come see you, they were probably going to end up in the same place. That's the only, I think it's so, so important to acknowledge that and have a respect for natural history and self-limiting conditions and not overextend ourselves, because we have such a huge problem with overdiagnosing and overtreating conditions that don't need treatment. And that's the kind of clinical behavior that does drive predisposition for chronic pain and disability and learned helplessness and all these things that
For sure, yeah,
we want to try and discourage. So like that's a huge, like that plays into the placebo conversation too. Like we also have
absolutely.
to consider that. Is it placebo? Is it contextual facts? Is it just the passage of time? Like what actually drives clinical outcomes? That's I think one of the posts I did, I've done so many posts about natural history. Um, I think one of them I did was, it was like the opening line was, if if I could pick like one thing that they would teach us on day one of chiropractic school and or day one of physical therapy school, like it has to be the very benign, positive natural history and self-limiting nature of almost all musculoskeletal aches and pains. Like that, I just like that is so huge. And we don't get that. We do not get that.
Right.
And there's so many students and so many even practicing clinicians who are under the
That
impression that their treatments are doing more
right.
than,
Plain God.
like that's so important. So that's the only thing. Like
Well,
as long as they're getting better, I always push on that a little bit.
no, I absolutely agree with you. And what I like about talking to you is like I say things, right? And like I have a lot. I could talk about that idea for an hour, and I know
Mhm.
you and I could talk about that for 6 hours, right? But
Mhm.
the way in which you come back with that is like, all right, yeah, I understand what you're trying to say, but like this is what I think of it, right? And in my stance of that, like I've caught myself before telling specific cases where like, I think I'm going to be a little bit of a catalyst for you to mid or to shorten that time frame of healing per se, physiological healing, and or what you're doing is going to be a catalyst, I should say, not necessarily what I'm doing, but different conversation. um but it's hard to separate that, like we always have the conversation with specific clients and patients where I'm like, hey, in the past you've had PTs, chiropractors, whatever, throw the kitchen sink at you. You've gotten tens, you've gotten muscle therapy, you've gotten load, you've gotten this, you've gotten, like, we don't know what's effective and efficient. Perhaps all we need is for you and I just to have a conversation. Maybe that's the kicker, right? And all the rest of that's just fluff of what's getting you better, right? And it is just the natural limitation of time that's going to get things progressed, right? um
Right, and that's the only thing where too, like the whole idea of being a catalyst or like, or maybe shortening the window that it would take for natural history. Like I really don't believe that we have the ability to do that, to shorten that window or like decrease the amount of time that natural progression of a condition would take to recover. I really don't think we can do that. I think what we can do though, that's pretty similar to what you're saying, is like we can still like provide the reassurance and the positive reinforcement that would maybe encourage them to re-engage with some of the stuff that they may or may not be avoiding or just get back to living. Does that have to do with like actual tissue healing or pain change? Like who knows? But there's still tons of value in like helping people maintain semblance of like a normal life as natural history runs its course. I think that's where we can have a little bit more of an influence. But
for sure. And like when I
um,
say catalyst, like, and when I've caught myself saying it in the past, it's like I'm trying to show you. I'm gonna be a catalyst in the sense where I'm gonna tell you what not to do, because like ice for some instances not helpful, very actually harmful in the healing process, right? Like Mike Stella's got a great course on the end of the ice age and like how the pro-inflammatory process is very crucial in stages of healing, right? It's like giving them that guidance of what not to do so that the timeline actually adheres to the statistical timeline of when things are supposed to help, versus just avoiding that body part, and then that timeline gets expounded upon and turns out to be 6 months instead of 6 weeks because they actually haven't been loading, they haven't been walking, they haven't been enjoying their life the way they could or should to help that healing process, right? So it's almost
sure.
teaching them what not to do to aid in that self limitation.
Sure.
I want to keep us on schedule here, and I know you got a busy one coming up here, so we got about 7 minutes left before I got to get you out. We got 3 questions that I ask every guest on the podcast. You ready for these?
Hmm.
Complete surprises. Uh, Feel free to make these clinical or practice related if you want to. I'd rather hear more about you than clinic, anyways, because that's my personality, and I don't know about the listeners, but it's all about me, anyways. Um, so, if you could be ranked top 10 in the world at something, what would it be and why?
Ooh, God, that's tough. Shit. I love playing guitar, and that's what I spend like a lot of my free time doing. Um, that would be sick to be like top 10 incredible at.
Clapton,
Um,
Hendrix,
yeah, yeah. I
John
think
Mayer.
that's
I
what I
know
would
you're
do.
a John Mayer guy.
Love them. I should get back to putting those videos up. I would get back to that. Yeah.
I dig it. I mean, I think it's funny that everybody's answers is always like, this weird sub passion that they have that they're like kind of good at, but like that's what makes us human, right? Like it's not what we do in clinic all the time. Like we're also human and have other hobbies and aspirations on the side. And like for me, it's always golf. Like I would love to be top 10 in golf. Not
Oh,
only
dude, you
not
should
only to be
see me
like
golf. I'm so shit.
perfect.
Oh
So we're
my
going
god,
this
I'm
summer
so
then, right?
bad. That would be
Um
fucking awesome.
But no, like it's not even for the sake of being good at golf and that feeling of a pure shot. It's like what that opportunity would bring you. Hanging out in the Bahamas for 4 days, like going to the clubhouse after and having a beer. Like that's what I want. Like that's the lifestyle that I want, right? Which is super funny.
Yeah, yeah.
What's one thing you know you can do better at and aspire to learn within the next year?
This one I'll go clinical, and it's always just communication.
Okay.
I talk about that all the time. Just my like, I think communication is 100% the most important thing we do with patients. I think if I had to like strip our entire job down to the only thing that actually like truly matters, I would say it's communication. And I suck at it. Like I'm truly not good at it. And I try really, really hard to get better at it. And I put a lot of time and money and effort into getting better at it. That would be for sure. Like every year, I'd like to be exponentially better at communicating with people in pain than I was the year before, for sure.
And you said this is a clinical answer, but I think it could go the same for a personal answer. Like I
Oh
think
yeah,
all of us, whether you're a clinician or not, can get better at communicating, especially
yeah,
now in the world of COVID, where all of our communication is via bashing behind a keyboard, right? But
yeah.
last one here for you. What's one actionable step that you would advocate for listeners to take better care of their relationships, their health, their movement, and their lives? Something they can do once a day, once a week, once a month, as a action item or challenge.
Uh, don't feel bad about doing things you like, because I think there's just a lot of pressures on people to like or not like certain things, and that leads them to like limit their exposure to like things they enjoy doing. But I don't think you should feel so guilty about like you know some of the things that we actually like to do on a regular basis. So I don't know. Life's not very long. You should probably try to have fun or something. I don't know.
For sure. No, I like that. And like I'm not big on New Year's resolutions, but it was like 2, 3 years ago. After I'd had my son and like a lot of clinical stuff had just weighed on me and like priorities got pushed towards making money and, surviving a clinic kind of thing. One
Yeah.
of my New Year's resolution ish kind of things was be the yes man that you once were, right? Like growing up, I was always a yes man. Hey, Reed, you want to come out and play? Yes. Hey, Reed, do you want to date? Yes. Like anything, right? Like I was always a yes man, and that led me to a lot of opportunities. And I think what you're getting at is kind of that idea of just say yes to things and like challenge yourself and try new things and try what you're interested in, even if it fails or even if you suck at it, like try stuff. And I think a lot of people are missing that, and it leads into a lot of mental health issues because of that lack of novelty in their lives.
Unless you like saying no to things and you like alone time, but you feel bad about it and you think you have to be more social, say no to shit. Like that's cool
I mean,
too.
yeah, yeah, yeah. Like, no, you're wrong. I'm right. Shut up. Just giving you shit. All right, man. Well, I appreciate your time. Greatly, greatly appreciate this conversation. I think listeners are going to love hearing raw, authentic answers from you and seeing potentially a more calm down side of Aaron today. Um, Maybe I caught you on one of those less spicy days. Maybe we'll have to have like a round two where I just get you like all fired up and piss you off first and then start talking. But yeah, I love it, man. Thank you so much.
Yeah, happy to do it anytime. I obviously I think my social media speaks for itself that I clearly like talking about this stuff. So
Right.
anytime you want to talk about it, or anytime any clinicians or students who hear this want to talk about whatever, emails, DMs, comments, whatever, I usually engage with people. I try to, but I want to. So yeah, I'm always down for whatever people want to talk about.
Perfect segue on your part into what I was going to ask next. Where can people find you? Where can people contact you? What's the Instagrams? What's the emails? What's the clinic name?
It's all just Aaron Kubal. on everything. And then don't worry about clinic name because I'm actually going through a merger right now, and that clinic name is about to
Oh,
change. So
but is the awesome logo gonna change?
I don't know. I don't know. Because I haven't decided. We haven't decided on the new name yet, and we haven't decided what it's all going to look like.
Okay.
But the old one's Twin Cities Rehab and Performance. I don't know why I called it that. It's stupid, and it's actually been a huge limiter for getting patients too. Because I work with people from literally all over the freaking world. I had
Right.
a new
Right.
patient yesterday from who lives in Germany, and sometimes people like when they are curious about working with me, they see the link in my bio and they see Twin Cities, and they just assume probably can't he probably can't help
Right.
me. But so I need to change that shit ASAP. That's the old one. I guess it's the current one, but that'll be gone soon. So
What's
yeah,
the
Aaron Kubal wherever.
what's the Step Brothers Prestige Worldwide or whatever, right?
I could
That's
just
what you got.
switch it to that.
If you're worldwide, you got to go Prestige Worldwide.
Dude, I'm down. That would be sweet.
Hey, you can. I'll take royalties on that idea. By the way, you're welcome.
You got it. It's all you. I think Step Brothers may have had it first, but you can be
Nah,
next.
nah.
Yeah.
All right, man. Well, you have a great rest of your day, and I appreciate it.
All right, buddy. Thank you. Thanks for having me.
Of course.